Welcome to another episode of They Call Me Warrior, a talk show where we talk about advocacy, real experiences, and research and development in sickle cell disorder. Today we have an advocacy champion with us. Please introduce yourself, ma'am.
Yeah, good morning, everyone. My name is Halima Nagado. I'm the founder of Impact Sickle Cell Anemia Foundation.
Oh, wow. So please tell me, how did you start Impact Sickle Cell Foundation?
Wow, Impact Sickle Cell Anemia Foundation is a long story. It's an impactful story. It started from me because I'm a product of sickle cell anemia. Sickle cell anemia disorder is part and parcel of me. So I will say that it's part of my story. It has entangled me like a web. I lost myself to sickle cell disorder in 2012. My mother also had sickle cell anemia. And then my grandmother had 4 children with sickle cell anemia. So I have gone through the consequences of sickle cell disease. So I told myself that if a middle income person and above will have difficulty managing sickle cell, then what about less privilege? Yeah, that was actually what informed my decision, what motivated me to move out there and see how I can contribute my quota to the society, creating awareness and then stopping the stigma and all of that.
Yeah, that's very important and very necessary what you're doing for the community. So please tell me about a story or a warrior that really made you decide that advocacy for sickle cell is very important and you need to champion this.
Okay. Well, I will still give a practical example, practical experience that I had. When my son had his last crisis, the one that led to his death in 2012, it was very, very severe. And he asked me a question that, what kind of sickness does he have? And it got me thinking because my mother had told me that sickle cell disease, or crisis, sorry, is more painful than childbirth, more painful than labor. So that got me thinking that if what this boy is going through is more painful than what I went through when I was going to have him, then it must be very, very painful. And I made up my mind that I need to go out there. The silence needs to be broken. The stigma has to stop, the spread, and also preach that prevention is the only cure.
Yeah, it is very painful. I've never given birth before, but I know that my crisis is extremely painful, and it's hard to even articulate sometimes when the pain is happening. So I do believe that can drive anyone to create awareness in the way that you're doing it. So I'm really thankful for that. So how do you feel about the current state of sickle cell in Nigeria?
Well, unfortunately, it's appalling. Attention is not given to it. The government isn't doing anything about it. The government pays attention to other health disorders, but for sickle cell, it's been in here for long. We have more than 40 million carriers in Nigeria, yes, and 150,000 born every year, according to WHO. But still, the government is not doing enough. Nigeria has the highest burden of sickle cell. And unfortunately, attention is not being given to it. So
that's cool.
I feel a lot needs to be done. The government needs to come in and intervene.
Exactly. Yes. Compared to other conditions that are all around, it just seems like no one really wants to pay attention.
Exactly. Like immunization in Nigeria is free. When government had paid attention, in the past to HIV, to tuberculosis, to polio, but nobody is speaking about free genotype testing. Basic free medical health care for sickle cell patients. All that is not being subsidized, maybe, medication for sickle cell and all of that.
So how do you feel about the current state of sickle cell in Nigeria?
Well, the current state of sickle cell in Nigeria is appalling. It's unfortunate that Nigeria has the highest burden of sickle cell disease in the world, with 40 million carriers, 150,000 children born every year with sickle cell disease, according to WHO. But the government isn't paying attention to it. Government has paid attention to other illnesses like HIV, tuberculosis, polio, immunization, all of that. But for sickle cell, regrettably, the government isn't doing enough.
That's true. That is very true. I feel sometimes I do feel very neglected by, the hospital system. And for example, I was born and raised in the UK, and one thing that stands out for the healthcare that I received there is that outpatient care was also equally important than when I'm sick in hospital. So the outpatient care would be, or if they'll send me a letter to come into hospital and say, oh, I have to come and check my blood count and see how healthy I am. And if it's low, then they'll say, okay, do a transfusion, or they'll say maybe you should try this.
Improve your diet.
Exactly, improve my diet. Or they'll ask me to let me check my brain, let me check my eyes, let me check all my bones. So there was a thorough check for me outside the hospital. And that's how I stayed very healthy over there. But honestly, I don't have like a proper doctor here, unfortunately.
Obviously.
It's just I go into hospital, have the emergency care, come out, and that's all. So it's something that we definitely need to work on as a country. In your opinion, apart from the government, who would you identify as the key stakeholders that can help with sickle cell in Nigeria?
Well, the number one key stakeholder should be parents, because parenting is very key.
Yeah.
You need to instill it into the, head of the kids.
Yeah.
While growing up, that sickle cell is not for. Let them know what genotype is all about.
Exactly.
Let them know the implication. Let them have an idea of the consequences and all of that. And then schools can also play a role. Yeah, school could also play, because what you get in school stays with you like forever.
Exactly.
Yes. So schools, and then the media too isn't doing it. As part of their corporate social responsibility, I feel that they should contribute by way of creating awareness.
Yes. They should. They definitely should, because they create awareness for, how things now trend, and people engage in conversations, and the media has a big role to play in that. So the media does have an important role, and as well as schools. Schools are extremely important. That's why the DD project exists, so that we can somehow get it to schools and they can add it to the curriculums in some way.
Okay, that's it.
So why should the general public know more about sickle cell? Because most people that I talk to, that I'm asking, please, why are you not talking about sickle cell? It's the general answer I get is that people just don't care. So why should people care? Yeah,
because sickle cell hasn't hit them. That's why I always say prevention is the cure. And sickle cell has a vicious cycle.
Yeah.
It can come to you somehow, you wouldn't know.
Yeah.
Like my mother had sickle cell. We wanted to break the cycle, as in break this whatever, and my husband was misdiagnosed. And here I was again, with a child with sickle cell. Yeah, so the people have to be involved. They are the ones who break that cycle. That is why it's critical. That's why it's important.
Exactly.
Yes.
It's very important. The cycle needs to be broken. We need to have, free genotype testing.
Sure.
We need to have the government to intervene, schools, all of these things can make a huge difference for all of us.
Obviously.
Thank you very much for this interview. Thank you so much for being here. We appreciate your presence, and good luck.
Yeah, thank you for having me too.
No problem. Yes. Thank you so much for joining us, and stay tuned for another episode next week of They Call Me Warrior.